याः सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत्। ॐ शान्ति शान्ति शान्तिः.
Thank you, Sarvesh. Good evening. My name is Padma Doniparthi. Thank you for joining this seminar and informational session. For the last 1 year, COVID has changed our day-to-day life. And for many of us, it forced us to rethink our priorities and at times tested our faith. During these difficult times, most would agree that we became closer to our families and spent time with true friends who were there to lend a hand when needed, both emotionally and physically. After receiving the vaccine, we'll all soon come out of this strong and healthy and hopefully get back to some of our previous routines. There has been quite a bit of information about COVID in the news and the media. Some of it is confusing, such as the different types of vaccines available, short and long-term side effects, length of protection, and the restrictions after the vaccine. Many of us are wondering, when is it our turn? Who will call us? Where do I go for the vaccine, etc. On behalf of the Hindu Temple of Wisconsin, I'm pleased to announce our own local infectious disease experts on COVID and provide additional information on the vaccine. We have two prominent guest speakers. First, I'd like to introduce Dr. Neeraj Sawhney. He studied at Motilal Nehru Medical College, India, and received further training in UK, where he obtained the MRCP diploma. He completed internal medicine residency at the University of Pittsburgh and fellowship at the University of Cincinnati College of Medicine. He is associated with the Ascension Health System and Frederick South Hospital in Wisconsin and has been in private practice in Milwaukee area for over 25 years. He is well known in the community as a physician and as a friend, and he and his family continue to be very supportive and involved with the temple. Our next speaker is Dr. Karthike Acharya. He finished medical school at Government Medical College in Surat, India, and internal medicine residency at University of Arkansas. He then served as chief resident for an additional year and then completed infectious disease fellowship at Medical College of Wisconsin in 2015. He also has master's in public health from University of Alabama. He joined Frederick Medical College of Wisconsin as assistant professor and is the current infectious disease fellowship director. He has won many teaching awards. Without further delay, we'll start the program. Just a couple of instructions. The audience will be muted except for the speakers. Please submit any questions you have by clicking on the chat button, and we'll cover as many of your questions as we can. Please stay muted during the session. We hope to have more updates and other future educational programs throughout the year. We're also pleased to announce that we're working on having pharmacies providing vaccine for members at the Hindu Temple location itself in the next week or two. Stay tuned until the end of this session for additional information to follow. Thank you, and we'll begin. Dr. Karthike will be presenting some slides and information. Sorry, Dr. Acharya, you may begin.
Good evening, everyone. My name is Karthik Acharya. Thank you, Dr. Doniparthi, for the introduction. I have a senior colleague from the community, Dr. Sawhney, who's joining me as well. We both, the plan for this 1 hour session is that we will do a rapid overview of vaccines, and especially vaccines available in US and Wisconsin, and cover some of the efficacy data, which essentially is effectiveness that was seen during the vaccine trials. We'll talk about the safety of these vaccines, and then we'll talk about what to do when you're offered the vaccine, what to do if you've had COVID before in 2020 or 2021. And at the end, for the last 30 minutes, or potentially more if we can get with our section done sooner, take questions from all of you and see if we can answer them to the best of our knowledge as of January 31st, 2021. With that, I'll go ahead and get started. Neither Dr. Sani or I have so no disclosures to share for this particular talk. This is just a customary slide to talk about COVID-19, which is this life-shattering pandemic, as Dr. Doniparthi said, has turned our life upside down. It's caused by the virus, coronavirus SARS-CoV-2, which is severe acute respiratory syndrome, coronavirus 2. There was a coronavirus 1, some of you may remember, around 2003, which did not spread worldwide to the extent this one did, but still scared a lot of people in medical and public health community. And there are a lot of other coronavirus infections too. And I think Dr. Fauci, which has now become a name in each and every household, had written a viewpoint in JAMA more than a year ago now, talking that this is more than the common cold, because many common cold viruses are also coronaviruses. So basics, it's an infection caused by a novel coronavirus. This was discovered in 2019 from Wuhan province in China. And it was it's a different virus than the SARS-CoV-1, which was around 2003. There have been more than 25 million cases in US, more than 430,000 deaths in US, and huge impact on physical health, mental health, economy, education, and all aspects of life. I think it is fair to say that no one can say that they have not been touched with this pandemic. So all countries and all socioeconomic classes, all races, and any other way we divide the population. So there is this website, Our World in Data, which has phenomenal slides and graphs that talks about new COVID cases that the world has seen. And as you see, thankfully, and I'm not trying to say that the cases that we see even in today's day and age are not a bother, and that we are still seeing thousands of people dying in US and worldwide with COVID, but at least the case rate seems to be going down. And we were all worried that 4 weeks after Christmas, we are all, the health systems, economy is going to be reeling more than it did in few months before, but thankfully things have slowed down. Hopefully the trend stays. And I have data regarding US as of January 29, 2021, and also from India here. And then cumulative deaths, again, worldwide, the number has been more than 2 million. In US, as we talked about, there are close to 450,000 deaths that we've seen. And India has also seen fair amount of deaths. India is next only to United States in terms of total number of COVID cases we've had. So India, our country, our native country, has been hit pretty hard as well. So why vaccines? And what is herd immunity? You may have heard that term repeated often. So vaccines and widespread vaccination are at the center of us getting a handle of this worldwide pandemic. Vaccines would make us develop herd immunity, would get us closer to thresholds of herd immunity, which would make this pandemic eventually die down. So herd immunity, which is also known as indirect protection or community immunity, or community protection, refers to protection of susceptible individuals against an infection when a sufficiently large proportion of immune individuals exist in a population. So herd immunity is so roughly, and we'll also talk about this term, which is called R naught, or basic reproductive number. So if I divide it, if I try and explain it very simply, R naught of any virus or any infection means if one person in a circle has that particular infection, how many other people in their circle will get that infection. Now that depends on how infectious the virus is. It depends on what is the status of people around that one individual. So if I am in one room with Dr. Sani, Dr. Doniparthi, Mr. Govardhan Kara, we are all in one room. I have coronavirus. if they are all, they've either had recently coronavirus or they've been vaccinated with coronavirus, and they are 1 week or 2 weeks out, my ability to infect them will be very low, essentially zero. So if this is how we if the herd stays, then the epidemic would eventually die down. So that's what that means. And the way we are able to create these pockets, this protection pockets, and make them bigger and bigger, is either we are surrounded by people who've had COVID in last 3 to 4 months, because we definitely know that reinfection rates are very low after the 3 to 4 months post COVID, or we surround people with vaccination. Now, we don't want to try a natural experiment of infecting people with coronavirus. So the best strategy we have is vaccination. And that's what is referred to as herd immunity. And there are a lot of estimates of what is the herd immunity looking like what. So, and this is a good paper from Journal of American Medical Association that said that if we assume that this coronavirus, the SARS-CoV-2, if Dr. Tony Parthi, Dr. Sani, or neither Mr. Govardhan Kara, neither of them were vaccinated, my ability to infect other people would involve 2.5 more people. So it's a very good chance I would infect 2 out of those 3 people, and maybe other people in my own personal circle and things like that. So what do we need? So that's R naught for this virus. We need to have community thresholds of 60%, potentially now, maybe higher, for this pandemic to eventually die down. It's a moving target. It's a moving target mainly because we don't know what would new variants bring, because there are some reports that they are far more contagious than the initial strain. So that's what some of these terms may mean. But the most important thing is vaccines are our way out of this pandemic, and that's the main message, and that's why the whole Hindu Temple is taking this initiative for us to talk about this important public health measure. So Wisconsin statistics, again, this is from Department of Health Services' website here. There are, we've had, again, a total of 500,000 plus cases. On January 29th, there were only 1,500 more cases added, which are far lower than the Wisconsin peak, which was in November, when we had anywhere from 5,000 to 7,000 new cases that we were seeing. And we were worried that at that pace, that the health systems are going to break down, and the way California was in a similar position around December. And this is how the Wisconsin graph looks like. Again, as we talked about, we went through hell in November, but the cases seem to be lowering down quite a bit. So with that, let's start talking about common questions that we can think about. So you may have heard a lot in news media, whether it's a print news that you see, whether it's through social media or local news channels or any other platform that you use. Like, you may have heard about the Pfizer vaccine or Moderna vaccine or AstraZeneca or the Oxford vaccine, or the news this week has been Johnson & Johnson or Janssen vaccine, and the Novavax vaccine. So there are a lot of vaccine platforms available. There are so far there are 2 which are mRNA-based vaccines that are authorized to use in US. FDA gave again a term that may become that you may have heard quite a bit, EUA, which is an emergency use authorization. The FDA gave an okay to start vaccinating people en masse with the different phases that CDC has outlined. So these are the 2 vaccines. The Pfizer-BioNTech vaccine has efficacy. So in the studies that they've done, it prevented 95% of infection 7 days after the second dose. It's a 2-dose vaccine. Moderna vaccine, which is the another company that had made vaccine, 94% efficacy at preventing infection 2 weeks after the second dose. So 2 vaccines, mRNA-based vaccines are the ones that are, as of now, authorized by FDA to give to individuals in US. And at US, 27.9 million doses have been administered up until now. And this image I got from a JAMA Network YouTube channel, which had, again, a phenomenal resource of common FAQs. What vaccines are available in Wisconsin? Same too, because Wisconsin is in US. So Wisconsin's not going to get AstraZeneca or which is the Oxford vaccine, or Janssen or Novavax vaccines up until US FDA authorizes its use. So both vaccines are available. And as of January 31st, which was yesterday, only 1.2% of Wisconsin population had completed 2-dose series, and a huge chunk of that are healthcare workers, physicians, nurses, pharmacists that are first-line workers, and residents of long-term care facilities. Again, the image is from this place. And these are, and to just think about what is Wisconsin doing compared to other states, West Virginia, Dakotas, Alaska, they are clearly leading the way in terms of how many vaccines they have given. And if you think about our neighbors, Minnesota is as a darker color, so has given more vaccines over their 100,000 population than Wisconsin or Illinois have done so far. So we are clearly lagging behind. So again, this is for total doses administered for vaccines, and these are number of people who have received 2 doses, so number of people who are done with their vaccination, at least in this initial campaign. And again, this data is as of January 31st, 2021. So people ask, is one vaccine better than the other? There are, of course, jokes in Indian community. We all like, 95% better than 94%, but they are essentially the same. So it's not like if you get Moderna vaccine offered to you, you shouldn't be like, oh no, I want to get the vaccine which is 95%. I think both are equally efficacious, both are equally effective. So if whichever ones you are getting offered to, you should use. And there's University of Texas Health, their Twitter handle had an amazing pictorial to show the differences or commonalities between 2 vaccines. So this was approved Pfizer vaccine was approved because that's how they studied the vaccine for 16 years and older. Moderna vaccine was studied in 18 years and older. Both are 2 shots. The interval for Pfizer vaccine is 3 weeks, 21 days. The interval for Moderna vaccine is 28 days. And we talked about the effectiveness. And in terms of their side effects, they're essentially the same. You can say they are basically mirror images. So injection site pain, very common after this vaccine. It was seen in almost 3 out of 4 people or more who had gotten this vaccine, chills and some achiness, somewhere around 1 out of 5 to 1 out of 4 people who had gotten the vaccines. So both vaccines are similar in terms of safety or how well they work. Important caveats are finish 2 doses. There is some data that 1 dose may be effective too, but you want to finish 2 doses because that's how the studies were done. And don't switch vaccines between your first and second dose unless there are some extreme circumstances. So say in case you got first dose as Pfizer, and then suddenly there's a Pfizer vaccine shortage, then and if Moderna is getting offered to you at 4 weeks, then you can get it after you hear that Pfizer vaccine is just not going to come. The chances of that happening are fairly slim, but don't routinely switch vaccines between your vaccine types between your first and second dose. So what's the recommended vaccine schedule? It is a 2-dose series, and we talked about 3 weeks apart for Pfizer vaccine, 4 weeks apart for Moderna vaccine. And an important thing is, how long does protection last? So first of all, before that, important caveat, this is the general rule for vaccinology. You don't want to take the second dose, which is supposed to get your immune system even more ready for when you get the natural infection at some point later. don't take that second dose sooner than recommended. So if for Pfizer vaccine that is 3 weeks, so if you're getting the first dose today and the second dose is going to be 3 weeks from now, don't try and get it around February 14th. That is too soon. That is too soon. You can take it at little bit after 3 weeks. If say at 3-week point, you just cannot do it because of some personal issue or some professional obligation or something like that, it's okay to take it few days later, but don't take it few days earlier. And then duration of protection. So studies are, so we've vaccine studies started getting done around July, or they kickstarted I think the phase 3 studies around that time. So we don't have a lot of long-term data, but at least we know that 4+ months of protection is there from both of these vaccines. Some experts think, based on complex immunology and other things that are involved that I won't go over, that the immunity may last for much longer, and we may not have to do vaccines every year the way we do flu shot. But again, the new variants and other things may change that scenario. But at least as of now, there's more optimism about this than not. How safe are these vaccines? Are there any immediate side effects? So both of them are quite safe. Most common, as we talked about in terms of immediate problems, are injection site pain and other injection site reactions. Severe allergic reactions were very uncommon. In Pfizer vaccine, or for 1 million doses that given, 6 cases of severe allergic reactions were seen. In Moderna vaccine, for 1 million doses that were given, 2 cases of severe allergic reactions. So these are substantially lower with a common drug that we use in infectious disease, the penicillin, which has an allergic reaction rate of 1 in 5,000. So Ashish Jha is a professor who previously was at Harvard School of Public Health, now is at Brown University in Rhode Island. He tweeted this, and which was remarkable information to just know. 26 million Americans have had COVID, the natural infection, and we've had 420, now 430,000 people who've died. 29 million Americans have gotten COVID vaccines, and 0 have died from COVID vaccines. So vaccines are far more safer than infection. So when you get offered, take it. How much do we know about long-term safety of these vaccines? So far, again, we've had vaccines for 6 to 8 months. No major flags in the studies that have done so far. Again, only we have months of data, not years of follow-up that like we do with some other vaccine. But CDC is not taking this lightly. CDC has an active plan on monitoring. There's a new thing that they started with this vaccine. Every time, as I was about to get ready, because it's been 7 to 8 days since I got my second shot, I got a reminder from CDC, because you have to sign up to give data to CDC and say, are you having any reactions? So they are really interested in making sure that community, as it get vaccinated, they gather data on vaccine safety. There's also a tried and tested system they've had for decades, is they have a reporting system. So there's a passive way of doing it, but also very active. They're like reaching out to you. So this is when hospitals, health systems report to CD and say, hey, something like an allergic reaction happened. This is like they are actively reaching out to individuals, including if you get vaccine, whoever gives you vaccine will tell you, please sign up for VSafe. And when they encourage you to do that, please do that, because I think we're going to have important data that we will add so that more and more we get more and more knowledge regarding vaccine safety, or if there are any signals regarding questions regarding safety. So CDC, again, has an active plan on monitoring both of these, which is good. So a common question that comes up is, should pregnant and breastfeeding women receive the vaccine? There is no reason why they should not receive the vaccine. There's nothing about the mRNA vaccines that say, oh, theoretically they would be unsafe for pregnant women. So there is no reason why a pregnant or a breastfeeding woman should avoid the vaccine. Granted, it is we worry about our babies are like, fetus or infants when you're breastfeeding them, and there are, it's okay to pause because we don't have data. But just so you know, studies did not actively include pregnant women, but and this is a data that on a CDC call that I just found out yesterday, is in both Moderna and Pfizer vaccines, there were women who later found out after they were enrolled in the studies that they were pregnant. And there are, including both of those studies, there are about 15,000 women who were pregnant when they had gotten vaccines. So we'll be able to get data on that. And so far, no safety issues that have been seen. And again, no logical reason to worry about vaccine safety in pregnant or breastfeeding women. Best to talk with your clinician and make an informed decision. But go with an open mind and consider it if your clinician's recommending it. And so an important thing everyone wants to know is, how can I get the COVID vaccine for my family member? I think Wisconsin State and also CDC had a plan on how they want to roll out the phases. The currently eligible phases are these. Frontline healthcare personnel, which were in the previous phase, but they are still included. Residents in long-term care facilities, nursing homes, and things like that. Now, the first responders, police and fire personnel, correctional staff, and adults 65 and older are going to start getting vaccinated. Some of them, some of you who are on call may have, even if you're not in medical field, may have gotten it if you are 65 and older, or would have gotten an invitation. Next eligible group are going to be teachers, so that we can eventually start, like all schools can start having, students in-house rather than virtual learning. And also, some other non-essential healthcare workers, or other like grocery workers, like grocery store workers, which are public-facing essential workers, and then facility staff and residents in congregate living settings. So these are phase 1A, phase 1B. Phase 1C is going to also include anyone 16 to 64 with high-risk medical conditions like diabetes, obesity, heart problems, lung problems, liver problems, kidney problems. And phase 2 are going to be all adults that are not captured in previous phases. Hopefully, in next few months, sooner than summer, we get to this phase. Do vaccines protect against emerging coronavirus variants? So you may have heard a lot in news again about a UK variant and a South African variant and a Brazilian variant. Good things are that, so Pfizer and Moderna vaccine both protect against UK variant. We don't have data against Brazilian or South African variant, but some of the other vaccines that were studied, the AstraZeneca vaccine and the Janssen vaccine, because trials were getting done in South Africa and Brazil, they do protect, because the circulating strains in those countries were the variant strains. They do protect. The protection is not 95%, but the protection somewhere for some it's 55, 60%. For some it's in about 70% ballpark range. But the important thing is they still prevented severe disease and hospitalizations and deaths. And remember, the worry about severe disease and hospitalization and death, that is what got this pandemic to bring it to bring us on our heels. Because if it was a respiratory viral infection that was just causing mild infection, nobody was really getting sick, then we wouldn't have shut down everything the way we did. So this is even though variants are there, even though the vaccine effectiveness for infection may be lower, effectiveness for severe disease and hospitalization is definitely there. So that's a positive sign. Do I need to get the COVID vaccine if I had COVID? Yes, you should consider it offered. Both ACIP and CDC say that you could consider to go back in the line, mainly because of vaccine shortages, so that others can get it. But in terms of it's been 90 days post your COVID infection, especially, like it's okay for you to get it. No safety issues for sure. So there are some other newer treatments that were done for COVID as well. There were, plasma, convalescent plasma, so from plasma from people who had recovered from COVID. And there are some other antibody infusion treatments. If you'd gotten those, then it's best to wait for 90 days post these specific treatments. Again, not because of any safety issues, but so that those treatments do not alter vaccine effectiveness. What do I do after I finish my 2-dose vaccine series? So sign up for this. This is my picture. You can even share your selfies with your family. That's what what I did, and get this data to CDC. For my first day, I was fair after my second dose because I was having some soreness over my arm where I'd gotten injection, but I did just fine after that. Can I go back to pre-COVID way of life once I get my vaccine? It's an important question, and I think we'll probably talk more about this. Maybe it all depends on what you are talking about. If it's talking about you meeting your grandparents who live in Chicago, after they've gotten vaccine, you've gotten vaccination, my personal vote would be absolutely. If you've been avoiding to see them for a long time because of worries about infecting, how long are you, going to keep waiting on seeing your grandparents? But if it's about, seeing your bigger circle and having a big indoor party for Super Bowl or something like that, maybe avoid that. If it's not your immediate family member that you can otherwise, meet virtually and do other things. What can we do now? So continue what we call NPI, or non-pharmacological interventions. Wash your hands, wear a mask, practice physical distancing, avoid large gatherings, especially indoors. Indoor gatherings have much higher odds of transmitting COVID than outdoor gatherings. So remember that. And then keep an open mind regarding new data and stay informed. Sign up for patient portal at your doctor's office. So that is one thing I will definitely say, that for even right now, the 65 and older that are eligible for vaccines, a lot of health systems, Ascension, Aurora, UW-Madison, Faded, I think what they're initially going to start doing they're going to send bursts of MyChart messages to your email to sign up. They will also send letters if you don't want to do MyChart, but letters are not going to reach you right away. So remember to sign up for MyChart. If your loved one isn't very good with a computer system, then a younger person in the family should help them and probably put their own email so that they can help them sign up. And once vaccinated, use VSafe. So summary: currently available vaccines and authorized vaccines in US, which are only 2 so far, are very effective in preventing COVID infection. Even the newer vaccines, which are not as effective maybe in infection prevention, are still very, very good at preventing severe disease. So that's welcome news. Vaccines are safe in immediate and short-term period. Long-term safety data is being actively monitored. And when you're offered COVID vaccine, take it. And that is it with my presentation, and I think we'll take questions from all of you guys.
Wow, very, very good information, Dr. Acharya. Thank you. I'm just really shocked that only 1.22% of Wisconsin population is vaccinated so far. Is it because of the supply, or is it just the delivery, Dr. Sani, that you feel is that we're still at a small percentage?
Okay, well, first of all, that 1.22 is those people who have received both shots.
Okay.
So it's actually more than that have started getting the vaccine, at least one dose.
Mm-hmm.
I can't give you that number, but it's probably at least twice that. So the reason was that there were some glitches in the layout of the plan for getting it going. So some places got a lot of vaccine, but they didn't have the setup or the planning to get people in quick enough. There was also a lot of hesitation or concern by the population. Some people in the population who were anti-vaxxers, maybe you call them, who were dissuading other people from getting it. So there's a lot of that. And as people got more, they saw people getting it without reactions, they started coming forward. So I think it's now picked up a lot. And one of the hospitals where I am, they are doing as many as 2,500 a week vaccinations. So it's going to pick up more. The supply is there, not quite as much as needed, but it's going to come.
Okay. So one of the questions that our audience asked is, what is the protocol for getting the vaccination? As I think it was mentioned that the healthcare systems will be sending out like these blast email or MyChart messages that they're eligible. should they just wait for that invitation, or are there places that are providing these vaccines that they should try to seek for themselves, or what are some of the options for people?
Well, those are good ways to get started. Even pharmacies are now, you can approach them to see where they can give the vaccine to you. But the latest thing is Wisconsin DHS is going to open up a portal within the next week or two for open registration for anybody to log in and sign up for it. So that's coming very soon.
Mm-hmm. And what is the safety for the 90 plus age group with the vaccine?
Boy.
I mean, they're saying, it started out saying 90 plus, right? Initially, they were the first ones, or the high risk.
Yes.
Then it was 60 plus.
I haven't heard of, like we heard in the slideshow, there hasn't been any cases of severe reactions. So hello? Yeah. So I don't anticipate, or I have not heard of 90 plus older people having more reactions.
Mm-hmm.
Their response may not be adequate because their immune system is low, but there hasn't been bad reactions.
And if anything, they may, I think they may have less injection site reactions and less fevers and fatigue, because all of those side effects are more tied with immune response. So actually, even individuals, not only 90 plus, but even some of our older adults, 65, 70 and older who'd gotten the vaccines, haven't had that much of injection site reactions and fevers and fatigue as some of the folks on the younger end have gotten.
Okay, all right. So another question, if someone was confirmed positive for COVID after their first dose, is the second dose still recommended?
Yeah, the thing about that is if they are symptomatic, they should wait until they are better and symptoms are gone and then get it. And if they are asymptomatic, they can go ahead and get it when their second dose is due. Karthik, do you think that's correct?
Yes, absolutely. I think it's if they are asymptomatic, a lot of I've had scenarios like this, that especially in long-term care facilities or where they started rolling out the vaccines, but they are also screening people on a weekly basis. And after the vaccine, suddenly later in the week they find out that somebody was positive. But if they are doing fine, they should still get their second dose as previously planned. Now, if they are sick and needed inpatient admission and are still in the hospital for, for if the outcome isn't, they're not recovering rapidly, they should just wait. They should just wait. Again, giving the second dose sooner is a problem. Giving the second dose later is not that much of a problem. And they will also probably generate immunity from natural infection as well.
Mm-hmm. Well, on that same note as being immunosuppressed or being able to mount of a less immune response, if someone had like rheumatoid arthritis and are on methotrexate, are they still recommending the vaccine for these folks?
Yeah.
For immunocompromised?
Yeah. Whatever response they get, it'll be some response. It'll be some immunity from the virus. So they are definitely, there's nothing to say they shouldn't.
Mm-hmm. When is a booster dose indicated?
There is no booster dose.
Any data like after let's say you're immunized with the second vaccine, or is it too early that, because we really don't know how long they're protected, right? So
yeah. The latest thing about booster dose is that one or two of those vaccine makers are saying that they are going to make a booster dose to act against the variants, the mutants that are coming up with the virus. To address that, there may be a booster dose coming, but that's just very early news.
Mm-hmm. Okay. So another question was, if one of the two, couple of the couple get vaccinated, the other person should still be careful, correct? The question is, if one family member gets the vaccine and other didn't, can they still travel, whether India or anywhere actually? Because the person that didn't get the vaccine is still at risk of getting the COVID and transmitting it, correct?
Correct.
Mm-hmm.
Yeah, they'll be exactly like anybody else, even if they are a couple. It's the vaccine is only going to protect the one who got vaccinated,
Mm-hmm.
and of course, the partner will be having less risk because he's most of the time with somebody who's vaccinated. But their own risk for anything else like traveling will be the same.
Mm-hmm. All right. If someone has ITP, can they safely take the vaccine? Idiopathic thrombocytopenic purpura.
I don't see why not.
Okay. Is there an immunity in India and Africa? Because we really don't hear about too many cases or deaths in these countries as we do in the US. Is it just because of the data that's not being collected? Is it a difference of the younger versus older? Or do these other countries have some type of immunity that they're protected?
So yeah, I think it's a combination of a few things, but important thing is we may not have accurate data as well. But there may be a combination of things. The BMI. I think if we just start with that, BMI of individuals in US is far higher than you'd see with BMI and the comorbidities that go with that, right? Like kidney problems, diabetes, in US versus other countries are going to be different. And I think those were the risk factors for major problems. And there may be some things with the immunity, there may be something about the data, something about the patient population, but I think we still haven't drilled down why exactly US is the main one that keeps having higher and higher cases. And India, which is second in cases, is not just, inching just very close next to it, but has quite a bit of gap between US and Indian data.
Mm-hmm. So this is the first mRNA vaccine, correct, using this technology? There was a question on how much do we know about this technology?
So good thing is there are this technology, they kept trying to use it for a few other things in field of medicine. I think oncology has been trying to use it for cancer therapeutics for quite some time. The same reason that has made the news often is the reason it has not been used widely in infectious disease, which is the stability of mRNA. We all have heard that the Pfizer vaccine needs minus 70 degrees and the Moderna vaccine needs minus 20 degrees. Otherwise, the mRNA are very fragile. They will not stay stable enough for the vaccines to do their job. That same issue has been the problem for it to make it to the real world. So technology is not new. It's used in vaccines, and an authorized vaccine is this is the first one of that kind. But it's not like people came up with this overnight or in middle of the pandemic, and then this is experimental that could affect people. Like the things you hear is, oh, RNA, so it may be something to do with our DNA and will it alter our DNA, and will it cause, some of the myths are, will it cause sterility? Will it cause, will it lead to HIV infection? None of those things are true.
Yeah, I think we have to give credit to the people who have done the research beforehand to get the technology ready, and then to the people who have done these trials in such a short time to go through all the phases and show data that showed 95% efficacy. And so I think we should lay those concerns to rest, that what is mRNA? It's been tried and tested, and it is showing good results. We don't know the long-term efficacy, and we don't know the long-term side effects, but these are unusual times, and we have to do what we have to do. If you see what we have seen, which I have personally been seeing, all the deaths and the misery that thing is causing, we need to accept the vaccine, and questions are fine, but I think at the same time we have to do what is right to get back to normal.
Mhm.
I'll also add there is a very famous vaccinologist in US is Dr. Paul Offit. He's at University of Pennsylvania and Children's Hospital of Philadelphia. When he was interviewed in November about these vaccines, when it was starting to look like they were very promising, he was very excited. But regarding safety, he paused because he's like, I'm going to look at the data for some more time, and if it crosses a particular threshold, if by 68 90 days all of the people who gotten the vaccine do fine, they usually do fine, then these vaccines are good. And when that data came out that they were the safety was well established now, at least for short-term safety, he came out and said, this is great now, this is great. And he has been the pioneer in terms of many other vaccine technology and things like that. So that was good to hear from his perspective. He was not gung-ho to begin with, regardless of what data it was going to be. He did pause early on and say, I will look at the data before I give my full endorsement. When the data was there, he's like, this looks good.
Okay. This is, I think, an important question. Will there be any certificate given or a stamp on passport that we're vaccinated as a proof to aid in international traveling? I believe after the first dose, right, you're given a card with the date and the type of vaccine you received, correct?
Take a picture of that.
Yeah. So you will get a card saying that the dates of your vaccination and the type of vaccine you received.
Right.
And take that card for your second vaccine too.
Mm-hmm.
Yeah.
Correct. Yeah. So question on immunity after getting virus versus protection from the vaccine. Do we know which one lasts longer? I believe
we don't have a time machine. So we have to go forward a few months to know.
I think for natural infection, we know there are some healthcare volunteers who'd gotten the vaccine who had gotten their antibodies tested serially over time. And we know that because vaccines came late, natural infection was there for a few months before that. We know that natural immunity in many individuals lasts 6 months plus. Vaccines, as we shared, we only have data as of now up until 4 to 5 months, and we know that immunity lasts 4 to 5 months plus. But which one is better, which one is going to last longer, we'll see. We'll see.
Right.
But our hope is that it will be similar.
They are working on many other vaccines right now, and there is one actually being studied in India, which is an inactivated vaccine from the virus, inactivated virus. So that will also create response in the lymphocytes, the memory lymphocytes, and that may give you a better long-term protection. So because it's not just looking at the spike protein, it's looking at the whole part of the virus. So we'll have to see what that does.
Which is the issue, right? One of the questions says, once we're vaccinated, are we free to travel internationally? I think that's the question is you're 94 to 95% protected, but there's always that chance that you can still contract and pass it to others. Correct? Dr. Sani, is that a good interpretation?
Well, that's a very important, that's a big question right now, that if we still have to keep doing all the things like masking and not travel, then what's the point? But until we get to that herd immunity, there will always be that chance. There is going to be a chance of still a small chance, but you can still have it. You can have an asymptomatic minor infection that may be transmit it to somebody else. So you could still travel. People are traveling now. So you could still travel, but do the other things that are necessary to protect yourself and others, such as masking and distancing, those kind of things.
Mhm.
I think there is this has so many nuances to it, right? The whole vaccination goal is so that we do two big things: protect our most vulnerable individuals, and to also eventually start opening up the economy, start opening up the door to life towards normalcy. So I think it is like, that's the example I was giving. Like if somebody had really close family living in Chicago and they haven't visited them for last 1 year, right? And now if they have gotten vaccinated, and like the Milwaukee household has gotten vaccinated, the Chicago household has gotten vaccinated, absolutely meet, because that we've been craving this for such a long time. Talk through what you want to do and things like that. Like, make sure everybody both families are on the same page. If they've all gotten vaccinated, I think they can meet with each other and potentially even not wear masks. I think there are some nuances regarding this, but I think it all depends on who you are meeting and what you are doing, right? Like again, an example I gave before, having a Packers party with people you don't know whether they've gotten a vaccine or not may not be the right thing. But as Dr. Sani said, the whole goal of vaccination so we bring life towards normalcy again.
Right. But I think until more people get vaccinated, we should probably maintain our masking and social distancing. So if someone, as this vaccine is being rolled out to more and more people, currently it's still 65 plus, correct? Even if there are sites that are offering vaccines, for example, we're hoping to, at the temple, have, if we have at least 30 registrants signed up for the vaccine, we can have the pharmacy come and provide the vaccine at the temple. But that's still 65 plus. Right now, we're in the process of getting the 65 plus vaccinated. When do we know when the next rollout starts? Any idea when that's going to be?
There's no fixed time. No, it all depends on how quickly we go through the eligible people now. Depends on supply, and depends on how quickly, how efficiently we get them vaccinated to go through the 1B, and then will come the next phase. So it could be, they're saying 1st March, but it could be earlier.
Mm-hmm. When is the Johnson & Johnson vaccine coming? I heard that the results weren't as effective as the Pfizer and the Moderna. Are they back to studying it, or has anyone heard when it's going to be, when there's more data, or when it will be released?
So I think we may know more in the next few weeks if US FDA will authorize it for us to use it. But again, I think it's important to see what that vaccine, Johnson & Johnson vaccine, brings a lot of advantages that Pfizer and Moderna vaccines don't. So it has it brings its own, it has its own pros. So one shot, not not any of those finicky temperature requirements, another big pro. And we have data. We don't have Pfizer and Moderna data regarding efficacy regarding other variants other than UK variant. For Johnson & Johnson's, we have data that they were 58% or so effective at preventing the South African lineage. But even in that population, it prevented severe disease. So I think there is still, it's still exciting news. It's still very exciting news. And again, as I said, we sometimes think about just purely the percentage and say, oh my gosh, like that one was 94, 95, and this is just, paltry 58 or something like that. But it's things that it brings, which are unique. So I think it still has its pros, and depending on how few things go, FDA may still authorize it for select, for its own niche that it has. So
If you think about it, the flu vaccine has no more than 60-70% at best efficacy. So even a 60% efficacy vaccine like the Johnson and Johnson is still good. So
Mhm.
I'm sure it will be approved.
Right. So right now, we just have to wait for our healthcare systems to send us some information on when the 65 plus population can get vaccinated.
Well, the best advice is for people to contact their providers or their hospital systems or the health department or the pharmacies. All these people will know, or will be able to tell you when you could be getting your call. So,
But if their physician is, let's say in Chicago, they should really contact their primary care doctor in Chicago, correct? Even though they're living here in Wisconsin?
they could use the alternatives,
Mhm.
like I said.
Any other questions? I think
I see all these questions on the chat.
mhm. I think we've pretty much covered all the questions that I see. Oh, is it necessary for the healthcare systems to make the vaccination mandatory to improve workplace safety? Is it necessary for the healthcare systems? I believe it's not mandated currently. It's still
Recommended.
recommended.
Yeah, it's not
That's
required, it's recommended, yeah.
Right.
that's the question. That should it be mandated? I guess it's only because it's an EUA vaccine.
Mhm.
It's not yet actually FDA approved. That's why legally we cannot mandate it.
Um,
So if there are no other questions, I would like to announce about something that we are trying to do at the Hindu Temple of Wisconsin. Padma, is that a good time for me to
yes, go ahead.
present? Okay. So this is Govardhan Kata. Let me share with you just some details. We are really excited to bring vaccination right to the temple premises. Here is just a quick slide. You're all able to see the slide?
Yes.
Okay. Just get this out of the way. Okay. So, so the details are okay. We need. I mean, we have made the temple premises available for vaccination for the groups, and the requirement is that we need a group of minimum of 30 people. I mean, again, the logistics, right? We all know about this Pfizer vaccine. It comes in refrigerated. Once we open it, it has to be administered. So for all the logistical purposes, we need a minimum of 30 people. The dates are to be announced, but first we need to gather the participants who are interested to get vaccinated. And currently at this time, as was already conveyed by Dr. Acharya, only outside of the healthcare staff, the current group is 65 and older. Pretty soon, I think we can migrate towards the next phase, which is the high risk category, and then into the second phase. But what we are intend to do is to start gathering interested parties who want to be vaccinated at the temple premises. So please look out for communication in this regard. An email will go out with a link to sign up and provide your information. Particularly in this time, it's 65 and older. Once we go past, we'll communicate further about the next groups. Unfortunately, we don't have the specific date of when we are going to do it at this time, but it could be as early as in the next 2 weeks. But we start collecting, we will start collecting this interested parties who want to be vaccinated. Any questions?
Govardhan, how do we make sure we are on the email list?
the fact that you are here, you are obviously, somehow you got the information, right?
We will email. We'll send out another email with the link to register.
All right, doctor. Yeah.
And
I just
then,
wanted to make sure that I got this email because I registered for the camp, but I don't get all HTW's emails on a regular basis. So just want to make sure I don't miss out on it.
Right. If you're not getting the emails, please just go to the HTW website and you can actually register to be on the mailing list.
Oh, great.
And that way you won't miss it.
All right. Thank you so much.
Yep. All right. Thank you, Dr. Acharya, Dr. Sani, and all the team for putting this together.
Yes, thanks for arranging all this. Thank you.
Yeah, thank you for the invitation. And this is fantastic that we are arranging vaccination through the temple as well.
Thank you, everyone.
Thank you.
Thank you.
Nicely
Bye-bye.
done.
Thank you. Good night.
Thank you, sir.
Chemical nana.
Hello?